From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Wednesday, July 1st, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. Yesterday, North Carolina Secretary of Health and Human Services, Dr. Mandy Cohen, announced a partnership between the state and Omnicare, a CVS Health company, to provide and pay for proactive coronavirus tests for the approximately 36,000 residents and more than 30,000 staff in private skilled nursing homes statewide. Testing will begin in July and continue through August, with a goal of performing 60,000 tests by September 1st. DHHS already recommends that nursing homes with one or more cases test all staff and residents. This initiative further makes testing available to all nursing homes to conduct a baseline test of all residents and staff. The state updates coronavirus data weekly from congregate living settings, which include nursing homes, residential care facilities, and correctional facilities. Through June 26th, 8,605 confirmed cases of the virus and 767 deaths were recorded in those facilities. 80% of those who have died of coronavirus in North Carolina have been over the age of 65. Cohen said the death rate in those over 75 is still high compared to other groups, adding that nursing home numbers may be going down mainly because of more non-nursing home cases due to the spread across the state. CVS Health will bill insurance as possible, and DHHS will cover any additional costs for testing. Facilities should continue to follow recommendations from the Centers for Disease Control and Prevention for repeat testing and work with community and private vendors to support ongoing testing needs. The U.S. is going in the wrong direction. That's according to Dr. Anthony Fauci, who told senators yesterday that some regions are putting the entire country at risk, just as schools and colleges are wrestling with how to safely reopen. With about 40,000 new cases being reported a day, Fauci, the government's top infectious disease expert, said he would not be surprised if we go up to 100,000 a day if this does not turn around. He told a hearing of the Senate Health, Education, Labor, and Pensions Committee he was very concerned about where the U.S. stands in its battle with the virus. Infections are rising rapidly, mostly in parts of the West and South. Today, North Carolina reported a record 1,843 new confirmed cases. It is the largest number of cases reported on a single day since the outbreak began. Fauci and other public health experts said Americans everywhere will have to start following key recommendations if they want to get back to more normal activities like going to school. Fauci told senators to connect the dots. When and how school buildings can reopen will vary depending on how widely the coronavirus is spreading locally. The Centers for Disease Control and Prevention plans more guidelines for local school systems, but in recommendations for colleges released yesterday, the agency said it won't recommend entry testing for all returning students, faculty, and staff. It's not clear if that kind of broad-stroke testing would reduce the spread of the virus, the CDC concluded. Instead, it urged colleges to focus on containing outbreaks and exposures as students return. Lawmakers also pressed for what Senator Patty Murray of Washington, the committee's top Democrat, called a national vaccine plan, to be sure the race for the COVID-19 vaccine ends with shots that are really safe, truly protect, and are available to all Americans who want one. The Food and Drug Administration released guidelines yesterday saying any vaccine that wins approval will have to be 50% more effective than a dummy shot in the final required testing. That's less effective than many of today's vaccines, but independent experts say that would be a good start against the virus. FDA Commissioner Stephen Hahn said vaccine makers must also test their shots in diverse populations, including minorities, the elderly, pregnant women, and those with chronic health problems. About 15 vaccine candidates are in various stages of human testing worldwide, but the largest studies, including 30,000 people in each, needed to prove if a shot really protects, are set to begin this month. And lastly, from WREL TechWire, small businesses and startups still interested in getting a Paycheck Protection Program loan now have more time to do so, and $130 billion in loans remains available. Applications were due to close on June 30th, but yesterday the U.S. Senate passed an extension pushing the deadline to August 8th. The program, as it was drafted in the earliest days of the pandemic and resulting shutdowns of businesses across the country, was intended to serve as a bridge for small business owners who watched their revenues vanish into thin air through no fault of their own. The aim was to help businesses keep employees in their jobs, and in turn, the loans taken out would be forgiven, essentially shifting into a grant. The small business program served to deploy more than $513 billion in loans to businesses, but as the shutdowns wore on, the structure of how that money must be used for the loans to be forgivable changed. A requirement that 75% had to go towards employee salaries was dropped to 60%, and the timeline in which it needed to be used, 8 weeks, was expanded to 24 weeks. Businesses with fewer than 500 employees can apply for the program on the U.S. Small Business Association website, sba.gov. This has been your Coronavirus North Carolina News Brief for Wednesday, July 1st, 2020. As always, if you like the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. Plus, while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.